Hello and welcome. My name is Vicky Wishay, and welcome to another episode of A Wealthy Life. This is part of a larger series of videos that I recorded while I was out in South Africa, and one of a number of very specific videos and podcasts that I've recorded with Dr. Julia, my wonderful friend and marvelous pediatric palliative care expert here in South Africa. So we've got, or we will have somewhere in the list recorded. You can understand how Julia got into this and what it means to be pediatric palliative care. We'll also talk about the work of Umduduzi, the charity that Julia and her wife and business partner Tracy run, and the difference that they make. But I thought, without being gory or macabre, it would help understand some of the issues that are facing the families here in South Africa with the children being ill. Not all of them die, so it's not all about death, but sadly it is for a lot of them. And how Umduduzi helps them and what it is that you can do there. So let me start off by just welcoming you. Welcome, Julia. Thank you very much for your time.
It's great to be with you again.
Thank you. So we've spent quite a bit of time with you, listening to you, how you work and visiting the hospital and everything. And one of the conversations that we were having as we were traveling from place to place, you were talking to me about, and I'm not going to use all the right medical terms, you can chip in, but the incidences of leg cancer or leg bone cancer and how it affects girls and boys differently, but also the difference between if you'd been discovered with that in the UK or Europe compared with if you're discovered here in Africa. Mm-hmm. Could you just, without sort of revealing, obviously we're not going to reveal anything about any specific, so in a very general way, just explain what this cancer is and what the families and the patient, the child, faces.
Okay, Vicky. Well, one of the more common cancers that we do see in children and teenagers particularly is called osteosarcoma. It is a bone cancer, and it is quite an aggressive kind of cancer. And if it's not picked up reasonably early, it tends to spread, and it spreads to the lungs. And we can manage it with chemotherapy and radiotherapy, but very often those children do die, which is really sad. And unfortunately, the way it tends to present, and you can imagine anyone who's had a boy who likes soccer, who loves to play with the ball, always outside climbing trees, has a small injury, and then has a leg or an arm that is painful. And even if you live 5 minutes from your close hospital, very few parents' first thought is, oh, this must be a cancer. He's complaining of pain near his knee. It's going to be cancer. No, most parents say, here's to paracetamol or ibuprofen, rest it, and we'll see how you feel. And sometimes it gets a little bit better, but as the weeks go by, that pain gradually gets worse. And eventually it gets so bad that they have to seek medical care. And at that point, if someone does an X-ray, they will be able to see that there is in fact cancer in that bone. And obviously that is a huge shock and a major, a huge burden on a family to bear and for the child. And suddenly they've got to go through the whole process. So where we work, the children come from the entire province, which is a very big, rural, mountainous, leafy green, beautiful province. But when you're traveling for healthcare, you've got to come a long, long way. They will go from their clinic to their local hospital. That's where they'll have their X-ray. The doctor will realize this is probably more serious than just a simple soft tissue injury and will refer them on for MRI scanning, CT scanning, and all the blood work to be done, at which point the child is diagnosed. Now, one of the things, if you present early enough, the orthopedic surgeons can attempt to just remove the tumor and to save the limb, which is great if it's small and it's early. That will then be followed up by chemotherapy and possibly radiotherapy as well. But sometimes by the time they present to the surgeons, the tumor is already very large and disfiguring and painful. And so one of the options is to do some chemotherapy to reduce the size of that tumor and then follow it up with surgery. And that might be to try and just remove the tumor or actually amputate the limb. And That is so difficult. If you think about an 11-year-old girl or a 14-year-old boy, the thought of amputation is horrendous. Then on top of that, many of our families have very strong spiritual beliefs, cultural beliefs that say that amputation is not allowed because then the body's not whole. So it really is very complicated decision making. And what we, as part of our role as Umduduzi and the palliative care side of things, is to come alongside of those families and really talk through the options, saying we could leave the limb on, but the cancer is likely to get bigger. Even with the chemotherapy, it's very seldom that the cancer would be cured by the chemotherapy. The treatment is actually surgical. And the chemo is to prevent recurrence. So we've got to try and get them to understand that either we try and take it out or we take the leg off, or we leave it and it will get bigger and bigger and more painful and eventually will end the child's life, or the child loses the limb and we potentially save the child's life. A lot of parents still hope, and teenagers particularly hope and cling on to the idea that they could salvage the limb. And very often we've seen that happen, and then it recurs and the child ends up dying, where if they had perhaps had the amputation, it might not have happened.
Yeah.
So it all depends on when the child is presenting in the spectrum of how advanced is the illness. But these are incredibly difficult decisions, and our role is to understand the spiritual and the cultural aspects, to understand the physical impact of the illness, to understand the emotional self-esteem, psychological issues, and really help that family to make the best decision they can for their child and for the child to be involved in that.
Yes, and with the child, not just for the child. But I mean, if you can imagine, and it's not that the playing football or the climbing the tree caused it.
No.
It's actually that it masks it. But if you had a son who was sporty, to think of that child no longer having a leg, never being able to play football or sports anymore. Hold on a second, there's all the Paralympics, which might not be on the radar of a family that we're here struggling, but it's not the end of the world. And if you had a girl and you're thinking to yourself, oh, but if I cut her leg off, then, maybe she won't find a partner and then she won't get married, but she will, people do. And it's easy for me to sit here, I am a parent, and to sort of logicize it. But in that moment, if you do not have someone there with you, translating what's going on so that you are in a position where you can really understand what the doctor is saying to you, it must be so difficult.
Really, really painful. I don't know. I mean, this is an aside. I don't know. Some of your the people listening may have been aware of Great Britain's Got Talent.
Yes.
And recently, one of the finalists was a South African, a young boy. Well, he's a young man now who had his leg amputated, and he's a dancer.
Yes.
Have
the
you seen
dance
him?
group. Yes.
Yeah. And he's been a huge inspiration to a lot of young South Africans who have had to undergo amputation, but not all of them are going to be professional dancers.
No.
But it's a very big, long journey for those patients. Yes. And we've had many children that have gone through it, and it is so difficult in terms of the spiritual pain. And the one little girl we worked with, she was 11. And so not completely able to make her own decisions, but very empowered. And she thoroughly believed that her ancestor would heal her. So she refused the amputation with the support of her grandparents. Her mum was a bit reticent and wanted to consider the amputation, but the young girl and her grandparents said absolutely not. And she called us weeks later to say, please, can we come and see her? She was in a lot of pain, and the tumor had grown. It was absolutely enormous, and the rest of her was completely wasted away. And she was having a spiritual crisis. She was so let down that she really believed she would be healed, and then she wasn't. And we really had to work very hard with her to come to a level of acceptance that, it's nothing, it wasn't her fault. It's nothing she could have done. And then she said
she was maybe bad that the ancestors didn't. Oh my gosh.
A lot of emotional and spiritual pain. And so as much as she had the physical pain, which is actually quite easy to manage, it's the emotional and the spiritual stuff that is
so you can give her some pills to fix the physical pain, but no amount of, whether it's morphine or anything else, is going to stop your heart from breaking that your ancestors didn't cure you.
Yeah.
Wow.
So we spent a lot of time with her, helping her to kind of work through her own emotions. And by the time she passed, she was really at peace, physically, emotionally, and spiritually, which, you know, as sad as we were to lose her, that was her journey. And it was just such a privilege to be on it with her, to make that difference that we might, you know, if she'd been doing that on her own, I can't imagine.
Yeah. She would have been dying in physical pain and heart, emotional, spiritual pain as well. Gosh.
And her family to have to watch that.
Yes.
Was really difficult.
Yes. And then, you know, at the end of this, what's left is the grandparents and the mother and the father, and they've still got to reconcile and cope with their grief at having lost the daughter, the granddaughter, and move forward. And that would have been so much harder if the daughter had been in agony, emotional agony, as well as the physical agony. Yes. My goodness. Yeah, it is just shocking, isn't it? The other thing that has happened while we've been here is you've had a huge delivery of prams. So what are you doing now? Explain.
So one of the more common conditions we see, and I've got no idea actually or real perspective on how common this problem is internationally, and whether it's a South African thing or a rural patient thing, but we get a lot of children that are born with hydrocephalus, which is effectively water on the brain. So the head grows quite rapidly. The water pushes onto the brain, so they're neurological developmental issues for the child, but also the head growing very, very rapidly. Again, if those children can get help quite quickly by a neurosurgical department, they may be able to put what they call a shunt in, which is effectively a little drain, which will prevent further damage and prevent the head getting bigger. And those kids actually do reasonably well and have good quality of life. And we see plenty of them, which is always our good story. But these children are mostly left with quite severe disability and perhaps may never walk. And as they grow, they become very difficult to carry and difficult to manage. And they've still got to attend physio and occupational therapy and, you know, hospital appointments. And these poor mums, when they're little, it's easy strapping them on your back with a blanket. It's a very common way to carry a child in South Africa. Not so easy when the child is now 8 kgs, 10 kgs, 12 kgs. So one of the things, it's a simple thing. So we walk the journey with these families, help them understand the condition, understand the future complications, help to, you know, when the child is having the surgery, to help manage the anxiety around that. But then, and also the stigma of having a child with a disability in the community, it is a stigma here. As sad as that sounds, it is a thing. But one of the little things that we can do is buy a stroller that is like an umbrella pram, really light, easy to carry, collapsible. So it doesn't really provide a lot of support to the child, but in terms of transporting a child from a very rural community, this mom can actually push the child to the taxi rank where she can get on her transport, and the pram doesn't take up too much space, because if you've got a huge buggy, you need to pay for an extra seat, and which is not practical for most of our families that have got very little money. So it is one of the tiny things we can do. We buy a pram, it's about 1,000 Rand. They fold down really small, and it just improves quality of life this much for a family that's struggling to move around a child that is growing but has a significant disability.
And £40, that's 1,000 Rand, £40. You know, how many cups of coffee is that? Or you know, a takeaway, a Chinese, forego your Chinese, and you could buy a pram or send money and buy a pram. And we will put the links in the bottom here so that if you do want to donate, but you know, £40 for a pram, it's changing the life of that mother, saving her backache, making her life easier, enabling her to get her child. And one of the children that we spoke about when we came to the hospital was a baby who had been born with hydrocephalus and cephalus, and not only were they then considering putting the shunt in, and normally you were explaining that the shunt drains the fluid from in the skull into the stomach, but this baby had got a problem with its stomach as well, and so you'd had to work on fixing the stomach, because without the stomach being fixed, then the child can't get the nutrition, and you couldn't put the shunt anywhere because, you know, and it's just such complex cases for these little mites, aren't they?
But also for parents to understand,
you know, because if you're not hugely educated in a traditional sense. And then you have laying on top of that beliefs about what's good, what's bad, punishment, curses, all of the other sort of layers of thoughts that can be there.
Yeah. And I think it's all just understanding the level of disability that a child will have. So many of these mums are actually diagnosed antenatally. Perhaps there's just too much water, so it's out of keeping when they get examined, so they might be sent for a scan, and then you can sometimes pick this up on a scan. Then that poor mum will come from wherever she is rurally to the centre where the fetal medicine unit is, will have a higher level scan, and on that day she may be offered a termination. And again, termination is different for everybody, but they're a big part of the community that is very religious and does not believe that termination of pregnancy is a correct way forward. So may refuse that, maybe for religious reasons, maybe because they have a hope that the scan was wrong and maybe the child will be normal. But just not having any idea of what the disability will actually be, and then trying to negotiate their way forward with that once the child is also born. So it is a very long journey. What we've recently started doing, Vicky, is we've got a doctor in that for 5 hours a week, our NGO is paying her to try and see these mums that get these antenatal diagnoses. It's a drop in the ocean, but just to try and help them cope with the stress of this pregnancy that somebody has said, well, we could terminate if you want to. Most say no, and then they've got to live with this uncertainty until the child is born. So we're trying to add in what we call perinatal palliative care as well for these families, so that there is a bit of support
care before
the
baby's even born. Yes, saying to the parent, your baby is not going to be that beautiful gift from God that you thought it was going to be. It's still going to be a gift from God, but it's going to have challenges. And no, I can't tell you what those challenges are, because it depends how the water has pressed and affected the development. And he was saying sometimes the brains can almost be to the point where the child is unable to sustain life because it's so little brain, so they might not be able to breathe or pump their heart. But then there are other bits where it might only affect their sight, or it might only affect their physical movement or their hearing, or any combination, depending on what part of the brain and to what degree it's been compressed. And even when you take the water off, the fluid off, it's not going to just fix itself.
No,
because the damage has been done.
But
then as the child grows, the brain, or the head, the skull grows, and therefore the weight is increased, which is why we have the buggies. But then the child can't support their own heads.
No.
And the long-term prognosis for these children, are they dying at 5, 10, or is it different for everyone?
It's completely variable. And I think, again, it depends on which part of the brain is affected. Those that have issues near the breathing center do die much younger, but may make it to 3 or 4. Some children, if they have a shunt in place that's working, they actually live, into adulthood. And can do reasonably well if their disability is not too bad. Children with any kind of neurological disability tend to have shortened lives because they've got other things. So like they get chest infections or feeding difficulties. And those are the things that create a higher level of stress and a burden of disease on the child. It's not necessarily the primary diagnosis that causes all the problems. It's the secondary effects of that. And then access to schooling. They're just the list of problems that these families face is enormous.
And these aren't families living a Western life where they've got the car that takes them to the doctors. We've talked about in another one of the episodes that they might travel 17 hours or longer to get to their hospital appointment every week or every month. If they're doing that, they might be missing work. They might have other children who's looking after their other children. Fortunately, a lot of the families have communities or family communities for support. But for however long any of these children live, there is layers of burdens on the parents. From a religious point of view, what did I do wrong that my child has been affected this way? Then seeing your child in pain or suffering in some way. Then the physical costs, even if it's just paying for the taxis to take you several hours to hospital. Then the toll on the family as a whole. How do they cope with all the other children if there are other children? it's just endless. And of course, still somewhere here, without the benefit of a benefit system, somebody needs to be working to bring money into this family who may be living in a rural community in not a traditional brick house like we would see.
So one of the good things that we do offer is that our government does have a disability grant system.
Right.
So as a parent of a child with special needs, you can apply for that grant. It is about 2,000 Rand a month.
So that's 80 quid.
80 quid a month to survive on. And that's because those parents are not able to go out to work, or they need to be able to pay a nanny to look after their child. So we do have that.
That's good.
It is a slight lifeline, but it's not a lot of money to try and survive on, especially if the idea is you having to go to physio, OT, your neurologist. Perhaps some of these kids also have epilepsy, so they're seeing, the hospital every month for their medications. There's a lot that has to be paid for within that tiny budget. So it's, at least we do have that benefit, but it could be more.
Yes. And then just to say that it isn't all bad news. So you got a message today, and you've had other messages of one child that is 12 years past their leukemia. So, that must be, I don't know, the little lights and the little joys that help you.
I think so. What Vicky's referring to is that today I got a WhatsApp message from a mum to say it's 12 years exactly since they met us, and her son has had his leukemia diagnosis. And he was a high-risk leukemia. So the reason he was referred to us is because it could have gone horribly wrong. So today I had a lovely moment where I got a WhatsApp message from a mum to say, today is 12 years exactly since their son had his leukemia and that they met me. And she just wanted to say, hello. And essentially he had acute lymphoid leukemia, and he had a very high risk type, which is why he was referred to us, because it could have gone horribly wrong, but it didn't. But the family had a lot of issues, mum and dad. I think one of the things we do see is that parents, when a child is very, very ill, they have different coping strategies. And so they can often end up in conflict, and it was a very emotionally charged situation. So both Tracy and I worked a lot with this family, not only around his pain and other physical symptoms, but around the family dynamic and just supporting the parents to love each other. And they're still together. And she just sent me photos of him at his prom. He was crowned prom king. He's, over 6 foot tall, really handsome young man, and he's still cancer-free. And the fact that after 12 years she's remembered and she just wanted to share that with me is just so hugely emotional and positive, that as hard as their time was, and yes, their story it ended really well, we were there for them in a time of stress, so much so that they've remembered.
I know.
And it just makes it all worth it.
It does, doesn't it? I mean, could we think of someone that has impacted our lives so much that 12 years after you saw them, you still think of them? I actually have one teacher who I think of so much. I had her teach me 3 times in primary school. She shaped some of the beliefs that I have, and I still remember her. I never was able to keep touch with her or not, but it's few and far between that person that you meet, and you are that person. You and Tracy are those people to so many families, to so many children, at possibly their worst times in their lives. You'd almost think that they wouldn't want to remember you. But
I think there are those that being in touch with us is a reminder of a very painful time, particularly if the child has passed away. But more are just grateful for the support that we were able to give them. And that it's such a privilege. It is such a privilege to be there when people really need that help and support, and to know that whether we're there or not, the child's still going to be sick. It's still going to be stressful, but just to know that we can make it a tiny bit less stressful by really understanding and asking what's happening in your family. Like we were talking about the women with the prams. That started with saying, well, in your life, what is the worst part in your life? And it wasn't the child's disease or the disability. It's carrying my child and trying to get my child to hospital appointments. Oh, how could we help with that? Would a pram help? Yes, it would. Bingo. We've suddenly got an avenue into being able to assist a family in a relatively cheap way. And I think it is about asking the right question. You know, what matters to you?
Yes.
What's impacting your quality of life? And very often it's not what the doctor would assume.
No. So in terms of that, here's the stack of all of my problems, all of my worries. You can just take out that one brick that actually probably knocks down
Quite a few.
so much other stuff, because then she's not as tired, she's not as achy, which makes everything else easier. She can get somewhere quicker, you know, just
she doesn't dread the hospital appointments as much.
Yeah. And then not so exhausted. Julia, just like I've said before, you are an endless inspiration. You really are. And I think possibly more on this visit to you. It's one of the first times that I have seen so many people we're just bumping into people everywhere. And I think maybe that's because you've been around so much, so long. You've been around so long now that there are so many people reaching out to you. But it's been incredible to see both how hard you're working, but also the difference that you're making to people's lives.
Thank you, Vicky.
Well, thank you for your time and having these conversations with me. And I hope that as the listener, you can take from this some of the very specifics about what Julia does and find your way to help. But also think of this as a metaphor, as a lesson. What can you learn from this? What could you learn from listening to Julia's stories about how the charity helps, how she helps, but also how the parents cope, how the children cope? What can you learn from this? I'd love to hear about it in the comments. Please do like, follow, subscribe, both on iTunes, on Spotify, and of course you can watch these on YouTube as well. And I'd love to get your feedback on this. Please do. Check in the notes for all of the links that you need to everything. And I hope that I've been able to give you a little bit of whoosh, a little bit of a jolt into recognizing that sometimes it's the smallest of things that can make such a huge difference to people. I'm not saying that anything that Julia does is small in the lives of these families at all, but the story of the pram, if there is a story that you can take from it, how can I help you? What is the biggest challenge that you are facing? And I'll ask you, what is the biggest challenge you are facing? How can I help you? What is the thing that actually might make a whole load of these problems disappear if we could have a conversation about it? What's your pram? What's someone you meet's pram? Where's the pram in the people that you meet's life? And you know, how can you provide that and help others? Really, I think that's what I want from this. Julia, thank you.
Thank you, Vicky.
Thank you for listening, and speak to you again soon.
I am Dr. Julia Ambler, co-founder of Umduduzi Hospice Care for Children. And I'm here today to ask you for help. Our job is incredibly important. We have a very small team of dedicated professionals providing another layer of support to children that have got serious illness and to their families and siblings. Palliative care for children is a very poorly understood field. A lot of people think it's only about death and dying. They don't realize how stressful an illness is for a family and a child that are experiencing it. So at Umduduzi, we receive referrals from the whole province of KZN. We see children from 0 to 18 with conditions such as cancer, liver problems, kidney failure, heart problems. These families are diagnosed, are given very serious diagnosis. They've got to cope with that emotionally. They've got to process it. They've got to understand the treatments, the implications of those treatments, the prognosis. There's also much time that a child spends away from school, spends away from home, being admitted into a strange and unfamiliar place. And then, of course, there's the spiritual side of illness. Very few of us can separate our mind, body, and spirit when it comes to something as serious as sickness, such as cancer. So our role at Umduduzi is to really focus on that, find out what are the issues that this particular family and child are facing over and above the simple diagnosis that they have received. how do we provide that extra support that they need? It may be as simple as providing them a pram, an umbrella stroller. Perhaps the child has got a neurological disability and transporting the child is so very, very difficult. That pram costs 1,000 Rand and is completely out of reach for them. But maybe we can relieve some of their suffering by providing them with this mode of transport that can easily be put into the taxi as they make their way to hospital for their numerous appointments. That help that we might give might be more about pain management. Very few doctors focus on what a child is experiencing. They manage the disease, they treat the pneumonia, they treat the cancer, but have they asked about what the pain is? Where is the pain? And how can we alleviate that pain physically, emotionally, and spiritually? So palliative care is really essential in any kind of healthcare setting. Unfortunately, in South Africa, it is purely in the NGO sector. There are very few people that are paid to do palliative care. And at the moment in South Africa, I am the only doctor receiving any funding from the Department of Health for palliative care. And I receive 10 hours a week to provide these services to the children of KZN. So we're in a difficult situation. We've got a nurse, 4 part-time nurses, a social worker, another very, very part-time doctor, a translator, and now recently we've employed a manager to help us with some of the fundraising because it is just such an arduous task. So despite being a small team, all of these people are professional and need to be paid. And the families that we support really do need that extra layer of support that we are offering. So I'm asking you today, it doesn't matter how little or how much, if you've got something to be able to give, whether it is in the form of a donation, such as a pram, or giving of your hard-earned money to pay for an hour of a nurse's time, we need you. And we really would be very grateful if you would consider following us on our social media pages, joining up to, we've got 100 Club where if everyone just gave 100 Rand a month, we would be able to cover all our costs quite simply. So please think about supporting us as we support the children with serious illness based in KZN.